My name is Lisa Moran, and I'm a qualitative researcher with the Center for AIDS Prevention Studies at UCSF and the Northern California HIV and AIDS Policy Research Center. This month, we're celebrating Earth Day, and we thought that it would be a great opportunity to take this time to look at some of the research that we've done on climate change and how it is impacting HIV care and services here in California. I think when people think about climate crisis in California, some specific images spring to mind. Wildfires, they're images of floodwaters rising. And what's important to understand about the impacts of climate change in California is that even if you live in an area where you've never had to run from a fire, it doesn't mean that your day-to-day life is not impacted. We initially started with a really broad question. And the question was, in what ways has climate-related events impacted the provision of HIV, STI, and harm reduction services in California? I think of California as sort of a bellwether state, and we wanted to focus on HIV, STI, and harm reduction services because those services are also, in a lot of ways, bellwether services. We had a suspicion that what we were going to learn was going to be focused on the patient population, was going to be focused on ways in which clients who rely on these services were, in one way or another, unable to receive these services. Their services were delayed. There was disruption in their timelines or in their communication with essential providers. And that is absolutely a part of this. But what's interesting is that what we primarily found was among the people we talked to, it was not the patient population that absorbed the brunt of this burden as much as the workforce, that a lot of the people who were providing these services moved heaven and earth to make sure that their clients still receive the continuity of care that their well-being and oftentimes their lives relied upon, even if that meant that people who had been evacuated or who no longer had cell service, who no longer had power, who weren't able to be in communication with their regular providers, it meant that a lot of providers went and tracked them down on foot. It meant that they were coming up with these really immediate, on-the-ground, innovative strategies to find the people that they were looking for, to make sure that the people they were looking for knew what to do next. Did they know where to go? If the clinic had burned down, or if part of the clinic was no longer accessible due to road closures, did they have another place to either receive their prescriptions or to go and do labs or to go meet with a provider or be in contact in one way, shape, or form? A lot of what we heard was that patients, while they did suffer, their care was not interrupted as much as we thought we were going to hear. And instead, it was the workforce that was experiencing a lot of trauma and was also dealing with a lot of the same issues that their patient population was dealing with, such as displacement, such as not being able to find family members, such as having their homes and their belongings being burned, being soaked, being unavailable to them in some way. This research is really special. We were able to capture and tell people's stories in a way that I think is essential to our understanding of what comes next. So in the short term, we focused on preparation, and we created a patient-provider toolkit in collaboration with a lot of our participants. And you can find that along with our participant stories at chprc.org. We also are focusing on further research, where we hope to better understand what the workforce that is providing HIV, STI, and harm reduction services needs to be themselves supported as they support the client population into what is a new climate era.